Hey everyone, this is Reggie from Result Plus Physical Therapy, and welcome to today's tip of the day. Today I want to answer a question that sometimes get asked by some of my patients who underwent knee replacement. Now, this is not very common, and I hope it doesn't happen very often. Is because it's not part of the recovery. It's not part of the normal healing process when you have a knee replacement. Although I've seen it happen a few times, so That's why I want to share this video. That's why I created this video. I want to share my answer to this because this can potentially lead to other problems. And if you're experiencing the symptom, I want you to go consult the appropriate doctor and look at it much further so that you can solve if there is another problem involved. Okay, so what is this question? So the question there is, what do you do when you have pain at the back of the thigh? So when you have a knee replacement, it's not uncommon. You're gonna have inflammation in the knee. Okay, it's gonna hurt. It's not only gonna hurt the front, it's gonna hurt the back part of the knee also. And the thigh can hurt also, lower leg can hurt also. You can have some referred pain, we call it. All right. So now, sometimes I have patients who they have pain from, let's say, the buttock area going down the back of the thigh, sometimes even going to the lower leg. And even if it doesn't start from the buttock area, it can be through the back of the thigh, kind of like the hamstring area, the back of the thigh, either stopping at the knee or even going down the lower leg. What do you do when you have pain in that area? One is definitely you want to be able to differentiate if that is just part of the knee replacement that happened that's causing that pain, or if it's something else. Because when people have leg surgeries, because the way they're walking is off, they're limping, very often people will get back issues also. All right, so that's a concern. So that is something that you have to pay attention to. If your quality of your pain is, it's more like electric, it's like shooting, like a nerve type of pain, that is something that's more indicative of maybe it's your back that's involved there. Maybe it's a back issue. Okay, especially if it's coming up from the buttock area that high, or it's coming from the lower back going down the back of the thigh. I want you to tell your surgeon, and also if you can actually go see a neurologist, so that way they can take a look at your back, or a lot of times the orthopedic surgeon can take a look at the back, and then they'll be able to tell, hey, you know what, is this coming from the back or not? If you're having physical therapy or you have access to a physical therapist, definitely let your therapist know. Then they can go guide you through some tests that will determine if this is because of a back issue or this is because of your knee replacement. Okay, so that's something that I want you to keep in mind. That pain at the back of the thigh may not be just your knee replacement. It may be a symptom of having a back issue as well. All right, so that's what I would recommend doing if you're having pain on the back of the thigh. All right, let me know what you think. Definitely, if you're having this issue, go consult your surgeon, go consult a neurologist if needed, so that way they can figure things out. Let me know what you think, and if you know anybody who had the knee replacement, or anybody who's having that pain in the back of the thigh, especially after a knee replacement, please share this with them so that they'll have this knowledge and they'll know what to do. So definitely you can share this video. Remember, I need you to comment, like, subscribe, and share this video so you can help transform other people's lives. Especially if they had the surgery, you can make the recovery a lot easier, a lot better, right? And let me know what other questions you have so I can help this recovery process easier for you, and then get you healing faster. All right? Would love to hear your comments. I would love to see your feedback. You can email us, you can DM us, or you can just post them in the comments below. Okay? Until next time, I'll see you in the next video. Bye.